Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
Well, I'm having a little bit of deja vu here. I am on Admiral Cochran Drive. It's 179 Admiral Cochran Drive in a relatively new business. I'm going to say it's a very new business.
November 1st, we opened our doors.
And I am here with Monarch Wellness. And the reason I'm having my deja vu is because I'm sitting in what is a conference room that used to be a studio that I used to sit in every single morning from about 5 a.m. till about 9 when it was WRNR. But we are joined today by Megan Gadsby, who is the owner of Monarch Wellness, which has taken over that space. And I thank you very much for inviting us in and teaching us all about Monarch Wellness.
It's a pleasure having you.
Well, I'll tell you, I first of all, your website is monarch4wellness.net. And I do have to appreciate somebody that likes a .net email address, okay?
It was what was open to us.
I've been there, done that. And subsequently, every domain that I've purchased, now it's just sort of a thing. It's like, oh, no, that .net is where I'll live in that. Tell me a little bit about Monarch Wellness.
So I am someone who never planned to have a business. It was never my goal to be a business owner. I'm a physical therapist, and I have been for about 13 years now. And it was one of those things where the more I practiced, the more I had an idea of where I wanted to be and what I wanted my clinic I was working in to be, but I couldn't find it. So at some point I was like, oh, I'll have to make that. So that's what we did.
Really? Do you know Josh Funk by chance?
I don't.
He is Dr. Josh Funk. He started Rehab to Perform. Very similar type of a situation. He was I believe a lax bro over at Maryland.
Okay.
And got injured, that sort of ruined his professional hopes of going professional lacrosse or beyond that. And he went into physical therapy. And he said that just during his college period, he realized that nobody was doing it the way that he wanted it to be done. Yeah. And he figured out a way to get it done. Now he's got like 6 locations, and he probably has 8 locations now at this point. But it's just, really kind of neat, which is very similar to what you said. Obviously they do the athletic type of a thing. And
so we are more of a chronic disease management clinic, which is unique. In PT, you see a lot of orthopedics where someone has knee injury. They come in for 2 months or so. They get kind of better and they go home. With the specialties we're seeing, which include oncology, rehab, includes lymphedema.
What's lymphedema?
Lymphedema is a condition where there's a dysfunction in your lymphatic system.
Okay.
And no one remembers the lymphatic system, but it's crucial to living. It is
all these systems.
It's a system that runs parallel to your arteries and veins in the body, and it carries waste, and it carries extra fluid. And it also brings all the fluid to the lymph nodes where it's kind of checked out for infection. So it's part of your immune response. And people can have a dysfunction where lymphatic system's blocked and they start to swell or start to have skin issues. So we see that in some people are just born with dysfunction in their lymphatic system. Some people have surgeries, like we see a lot of breast cancer patients and other cancers where the lymph nodes are damaged in surgery. Some people, it's over time, it can kind of start to develop.
Interesting. So that's sort of like your sweet spot.
So lymphedema is a specialty. It's very sought after because, believe it or not, a lot of people are affected by lymphedema. And then it tends to go hand in hand with the oncology treatment. And I just found I really appreciate working with this population because they're usually very motivated to get their lives back, function better. And with these chronic diseases, it's not just a PT thing. It needs a whole well-rounded wellness approach. So that's where I was always wishing that I had a nutritionist just down the hall that I could send my patients to so they could talk about what foods to reduce inflammation or how to work on maintaining a healthy weight.
Well, obviously that's one goes with the other. I mean, it's a balance.
It does, but it's kind of unique to see a clinic that has both.
Well, who do you use for a nutritionist?
Jenny.
Oh, you've got your own.
Yeah.
Tell you what, we definitely want to talk to it because I mean, like I say, that's got to be a huge thing as far as recovering from anything, whether it be surgery or whether you have diabetes or the lymph nodes are an issue or coming through cancer. But I mean, to make sure that you're eating as healthily as you possibly can.
Goes hand in hand, and the two really work together. And the other thing we have is an exercise physiologist, so that after someone is finished working with me, they still need support and exercise in a lot of cases. We don't want people to be discharged from therapy and then just go back to not exercising. So we have Rachel Lintz, who is our exercise physiologist, and she helps people to kind of continue with their exercise journey. So we're thinking long-term in managing chronic conditions.
Okay, so again, and I'm going to come from like an injury standpoint as opposed to but I mean, you're the one that when I have my knee done, okay, you're the one that's bending my knee and making it hurt and making me hate you.
Yeah.
For 2 to 6 weeks or whatever it may be.
Yeah.
And then your physiologist?
Exercise physiologist.
She's the one that is telling me, okay, so now when you go home, just to make sure that it continues to remain healthy, that this is the exercise thing. But she would work.
So not exactly. So as a PT, we do the treatment in clinic. We develop a home exercise program. And what we do is consider skilled and medically necessary. That's what you have to be to be seen by a PT. So when people can do their exercises independently, that's when I should be able to discharge them. But the thing is, people really respond well to having an appointment they need to show up to and having someone tell them what to do.
Oh, sure.
So that's where people can continue to come to our space and continue to get that support. But instead of it being physical therapy, they've kind of graduated out of physical therapy. Then they can work with Rachel.
So it's into sort of like a gym light.
Yes, exactly. It's a comforting gym for people who maybe don't want clanging weights. They don't want a lot of chaos or space, and it's fully supported. We have someone working with you.
Well, I must say, it's got to feel very comfortable. I mean, gyms, as a rule, are very uncomfortable places to be anyhow. It doesn't matter whether you're overweight, whether you're skinny, whether you're not very strong, or whether you're a super, all the mirrors, all the cameras, and all the selfies going on in there is just kind of crazy. And I would think that if you come through here with a chronic illness, you're used to it. This is, the people, the place, and then there's a certain level of comfort that.
Absolutely.
And certainly somebody telling you, push harder. I mean, my knees, I'd still be in therapy if I didn't have somebody that I hated telling me.
That's why I don't specialize in knees.
Yeah, no offense, sir. But to sit there and say, do it, no, you get on that bike and make that full circle. I'm like, no, but it hurts. Do it.
It's, it's
a good motivator.
It is a good motivator. And we take a lot of pride in making our space really comfortable. It's a podcast, so you can't see, but we have a lot of sunlight, plants, art, because we don't want people, especially like our cancer populations or, people going through chronic disease, to come in and have it feel cold and distant. We try to really have a warm, inviting atmosphere.
When your cancer patients come in, I mean, what are they being treated for at Monarch Wellness?
So it can be a variety of things. Sometimes it is the result of the cancer itself. So for instance,
I guess a breast cancer mastectomy it's upper body exercises. And
so if someone has a mastectomy, that changes the whole biomechanics of their upper body. So they're going to have tightness, they're going to have a forward shoulder, they're going to have abnormal posture. So that's one thing. And then if they've had chemo, maybe they have cancer-related fatigue and they're having trouble getting up to the energy level that they want. Or maybe they have neuropathy, so they can't feel the floor as well when they walk. So we can work on their balance. Radiation tends to cause tightness. Again, we have that biomechanical changes. So I do a lot of manual therapy. I do a lot of work with balance, just helping people increase their endurance. It's different from person to person.
I had no idea there were that many types of side effects from cancer, whether it be through chemo or radiation or certainly the cancer itself and stuff. I mean, I figured when you were removing something, there's something, but wow.
And I think it's appropriate to think of cancer as a chronic disease. A lot of times people, you have it and then you don't. But when you have cancer, if you have a surgery or chemo or radiation, there are long-lasting effects, anywhere from, when you're diagnosed to the rest of your life. It's helpful to have people who know what those are familiar with what they look like. And we kind of think of bringing patients in, and we're here for them, whatever stage of disease or healing they're in, and we adjust to what they need, what their current goals are.
I mean, you're so much more than a physical therapy practice.
I'd like to think so.
When I first, heard about Monarch Wellness, I was like, okay, so they got like the exercise machines and what I typically think of, and again, my limited experience with, my knee going into a physical therapy and what I've heard of people. But this is a wonderful option for people that are dealing with a cancer diagnosis or, the aftermath of a cancer treatment.
Absolutely. And that comes a lot from my personal history. Both my parents had chronic diseases. So I'm very familiar with how it's not just one episode we get over. It's something we're continually adjusting to. We're continuing to try and find the best thing that works. And my father did have metastatic bladder cancer. So it's near and dear to my heart to give these people a place where they can really meet their optimal performance for where they are.
That's wonderful. And again, you mentioned Jenny is down the hall in your nutritionist. Is there a chance that we could talk to her about where nutrition plays in the role of the whole rehab?
Absolutely. I think she'd be willing.
Well, Jenny, you obviously have not been here much beyond November since it just opened up in November, but you are the nutritionist half of this. And I mean, I'm sort of fascinating with what Megan had said, that this is just a very all-encompassing type of a practice. And we agreed that, the one hand is the other. And I mean, it's a balance of nutrition. So what's your role here?
So I am a nutritionist at Monarch Wellness. And the way I feel about the practice is that we're building a very supportive community. And really aiming at comprehensive care and supporting individuals, meeting them where they are, and really helping them move forward and live better, live healthier, attain high well-being. And nutrition is a part of it because we eat. We kind of have to every single day.
Yeah. Sometimes we forget, but that's not good.
Yes. So food plays a major role in our health, and finding ways to support individuals with food is something that I find fascinating, and I love it because, like I said, we all need to eat, and here you can kind of pair the need to eat, the social aspect of eating and enjoying food, with all of its healing potential, and really create a program where a person can get healthier with each passing day and passing year through eating beautiful and delicious food.
Everybody's diet is different.
Yes.
And people react to food much differently. I know my sister always used to say that no matter what she ate, it went right to her butt, and butt to the thighs, and it was other people goes to the hips, and whatnot. But what does a nutritionist look like when you're dealing with somebody that has come in with a chronic illness or a client patient? What do we call them here?
I call them clients. My background is in integrative and functional nutrition. And so the whole concept of integrative and functional nutrition is about supporting optimal function and really individualizing care. So you asked me about a typical, the typical approach is that I see every individual as a unique and one type in the world kind of person. And so my goal is to meet them where they are, find out what their health goals are, find out what their food preferences are, because for me to give a recommendation that a client is not going to follow is absolutely useless. I'm here to support people, and the people that come in, they have their own vision, they have their own views, and my job is to support them. I provide information. We talk a lot about the different, aspects of their health, be it specific medical diagnoses and medications, as well as their own personal preferences and beliefs in life on health and wellness. And through patient-centered care, basically a very individualized and personalized program is developed over time through multiple sessions so that people can do what they need to do on their own terms. So they are, especially when dealing with people, working with people with chronic conditions, there are so many things that impact how people perceive food, their appetite. Those people who have undergone chemo and radiation, they may have difficulty swallowing or changes in taste or flavor perception. So figuring out, how do we nourish the body and make the food appealing while there are so many different restrictions? And those restrictions don't necessarily have to be medical. They can be, and by medical, I mean related to medical treatments. But
Sure.
They can be related to personal preferences, cultural preferences, or just personal, like individual intolerances.
Well, again, as Megan had mentioned, you've got lymphedema patients that may be swelling. Okay, so there may be an issue, I guess, for my goal may be weight loss in that instance. And then again, without knowing the ins and outs of it.
Right.
But somebody may have a goal of weight loss. That's what I need to do. And maybe it's just because I need to lose weight to feel better about ourselves. Mm-hmm. Others may be strengthened. And all that tries to, but you actually come up with a food plan and a menu per se?
So all of that is done collaboratively with the people that come in. I actually don't tell people what to do. I provide the information, and then we collaborate on what would be doable and achievable for the person at the state of their life in this very moment. These things will change over time. Maybe it's a busy time at work. That means that while they're very busy, we have to make adjustments. And then when that time passes, we make further adjustments to allow for, let's say, more time, less stress, etc. But in terms of lymphedema, diet actually plays a significant role in lymphedema treatment, not only because of weight, because weight is an independent factor, but also what you eat specifically that has nothing to do with weight may impact lymphedema intensity. And so figuring out specific foods that may need to be either removed, added, or replaced can change the circumference of swelling, etc.
I know my son has Crohn's, and he had to really drastically change his diet from what he loved. He hated it, but he's getting used to it. Just while I've got a nutritionist on the line here, what's your opinion on Ozempic and the other kind of drugs?
Oh my goodness! So there's a time and a place for everything. So I don't usually have an opinion that something is totally bad or totally good or must be avoided or must be taken. Working with a whole lot of patients on Ozempic, I have seen, the good, the bad, and ugly. So it really depends on the person. For some people, Ozempic works really well. For others, it doesn't. So it's very much a personal choice. And then once that personal choice is made, further exploration of, how does my body get impacted by the medication?
Right.
So yeah, it's like I said, my thing is being very personalized and treating each person as an individual, not as an umbrella term for a disease or a study.
It seems to be the ideal way to do it.
I try my best. I absolutely love what I do. Being here has been absolutely amazing. This is the environment here is so kind and warm. And when I said we build a community, I truly believe that we do. Like the people that come in, whether they come in to work at the gym or to see Megan or me, we are all communicating, we all talking and supporting each other. And it's a very different approach and a different state of being than at like a regular medical office.
Well, it does sound like it's a very holistic type of a practice, and that you're collaborating back and forth between one another, the physiologist, the nutritionist, the physical therapist, the whoever, the receptionist up front that's taking the phone calls to make sure that people are coming in and going out as well as they can. Jenny, I saw on the website that there's like events and classes and stuff like that. Do you guys offer, instruction, I guess?
Yes, for sure. We offer various group classes, and we actually, starting next week, we will have another round of nutrition basics. It's a 4-class series, where we explore the fundamentals of nutrition, blood sugar regulation, inflammation management, and also how to apply that knowledge to your plate to make the food beautiful, delicious, nutritious, and enjoyable, and at the same time, very easy to prepare. So it's an in-person class, although we will have a virtual option for attendance.
Because everything's virtual now that we're out of COVID.
Yes. I find that, the having both options really can meet everybody's needs. But the in-person class is definitely something that is small group, very informal. We talk about the very basics and how to apply them in life to support one's wellness. We also going to start a diabetes program, and that's going to be a comprehensive 8-week program where people will be coming in for exercise, coming in for group nutrition classes, as well as individual nutrition sessions.
Wow.
I'm very excited about it.
And I'm presuming that those will continue sort of rotating and as new classes come in throughout the year and on and everything else.
Yes, we actually had the first nutrition series of the 4 classes last month, and it was so successful that we started a new one again. You get to not only learn how to eat, but you get to taste all the food. So this is not just talk. We talking and we eating, we tasting, we discussing, and it's all fun with a little bit of science.
There you go. Again, Monarch, the number 4 wellness.net is where all that information is on there. Well, I'll tell you what, let me get back to Megan because I want to finish up with her and get find out a little bit more about Monarch Wellness.
Absolutely. It was a pleasure talking to you.
Megan, that's fantastic that you assembled this whole team of people to holistically, is that the right word? Holistically handling, or to like the whole person? I mean, holistic sounds like mumbo jumbo and eye of Newton, all that kind of stuff.
Yeah. So that's we see the whole person, we treat the whole person, but we're a science-based, research-based, clinic in terms of we're not.
Right.
I don't want to insult. We're not just like lighting.
There's no eye of Newton or incense. I get it.
Yeah. No, we see the whole person. We treat the individual, but we're using research, we're using our own personal experiences, and we spend a lot of time trying to find what works for the individual.
You know what I really like about you guys is that you are not a normal physical therapy office, and you know who your client is. I mean, if I came limping in here saying my knee hurts, mm-hmm. I'm thinking you might refer me to somebody that can make my knee feel better.
Yeah, I mean, I can treat knees. The thing is that especially lymphedema therapy is in a high demand. So there are tons of PTs that could treat your knee. There are not as many who could do lymphedema. So we try to prioritize our specialties.
How did you get into this?
So as a student physical therapist, you go through different clinical rotations. And one of the ones that I went through was at a cancer center in Spartanburg, South Carolina. And that got me the foundation in lymphedema. And I wasn't even sure if I liked it because it's an interesting treatment that involves a lot of slow massage and then wrapping people in bandages. But I got that foundation. And like I said, it's a specialty that's in demand. So pretty much everywhere I went from there was like, oh, you can do lymphedema. So I've done it throughout my career. And then more and more I've gotten interested in cancer patients because those diagnoses can go hand in hand. And coming from my interest in chronic disease, just thinking about ways to best suit these populations.
What would you be doing if you weren't a physical therapist? What if, when you applied to college and you went a different route?
I love plants very much. So I might...
Horticultural?
Actually, when I was going back to school, I was debating between landscape architect and physical therapist.
So you like plants, and that probably explains why you've got a lot of plants.
Yeah, I think they're giving us some fresh air and some, like I said, some joy, some holiness.
Well, you've said the lymphedema treatment is in high demand. And certainly I would think that the specialized and the customized treatment that you offer to your clients, that are suffering from chronic illnesses are in demand as well. What does the future hold for Monarch Wellness? I know you've only been here, a handful of months at this point. So, I mean, but what's your big picture going forward? Or is this something that you're thinking of yet?
Oh, absolutely.
Says the woman who never said she was going to go into business by herself.
But I got ideas. So our PT branch is very full already. So I'm looking to hire a new physical therapist or two to help take on the PT work. And then with our exercise program, we often run small group classes. So that helps in terms of building fellowship with the people you're exercising with and keeping the cost down. We're doing small group classes, our exercise sessions with our exercise physiologist. We're also looking to develop some more bigger classes, fitness classes. And then with Jenny in nutrition, we're developing these nutritional series and classes. And a lot of that's coming from what our patients are asking for or what we see keeps coming up. So we didn't necessarily think when we opened the clinic, we should do a diabetes program. But we saw enough patients coming through with diabetes
to say we should do a diabetes program.
We should do a diabetes program. And we have, ways to address it. We have exercise, nutrition. And then if someone has special needs in terms of, a physical therapy problem, then they have me.
That's fantastic. I look at some of the different cancer treatments that are programs that we've got. I mean, I'll pick on Wellness House for a little bit. I mean, they've got just some wonderful programs that go on there. And you look at like the Almond House up in Baltimore, which is sort of, offering support to people. But I mean, a cancer diagnosis really throws a family and a person, into a turmoil. Mm-hmm. And to be able to come into an organization like this, nurturing, caring, all encompassing, I'm avoiding that holistic word, but that's able to treat the whole thing. Let's look at diet. Let's look at exercise. Let's look at any kind of physical rehabilitation that we need to work on.
And community. Community is a huge aspect.
And other people. I mean, you're not dealing with the Laxbro with the shoulder surgery recovery.
Yeah.
Great idea.
Thank you.
Well, I wish you all the success. I'm going to be interested to follow and see what it is. But I do encourage everybody to take a look at Monarch, the number 4 wellness.net. And certainly if you or a loved one is dealing with a chronic illness and you feel that some of the services that they offer may be of help, and I'm sure they probably will, come on over. They're sort of tucked behind the big brick building on Admiral Cochrane Drive at 179 Admiral Cochrane Drive, even though it doesn't look like it's on Admiral Cochrane Drive, but it's a wonderful location and a bunch of great people that'll, keep you healthy, not wealthy, but wise. Healthy.
It all goes hand in hand.
That's true. That's true. Thank you guys so much.
Thanks for having us.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.